Today's the topic is pulse diagnosis of cardiac and hepatic disease in Ayurveda. The speaker is Professor Suresh Kumar.
Dear friends, we'll be discussing pulse diagnosis today. Though the topic is on cardiac and hepatic conditions, we'll have a little introduction and the broader scope, expectations, future possibilities and utility of pulse diagnosis in health and disease. Ayurveda medicine has been using pulse as a tool of diagnosis since Ayurveda itself came into existence 5,000 years ago. But we talk of 5,000 years for a landmark. Otherwise, it is taken to be with the dawn of humanity. It is taken to be from the day when Ayurveda came or a system of medicine came into existence. Later, only in 17th century, Yoga Ratnakar is a Ayurveda text that mentioned the pulse examination in details. Later, many books came into existence. Many authors wrote details, made explanations about particular pulse and its inference. But mainly when we talk about diagnosis, we'll see that Ayurveda has been using pulse as an important tool, not alone, but among other important tools of diagnosis. In the language of, or in the terminology of Ayurveda, we call it Ashtvid Pariksha. So pulse is one of the important component of the Eightfold Examination for diagnosis. You see, pulse is one of the important, but another points of examination are Jibha, Akshi, touch, sound, Mal, Mutra, Sparsh, Netra and pulse. So it is the entire examination of the human body. Each examining point gives you some sign and symptoms, some objective or subjective parameters are examined, leading to a provisional diagnosis. And further, to confirm the diagnosis, there are much more further details of each of them, and total study, analysis, counter checking, all that then results into a particular diagnosis of a particular disease. Now, pulse has been important in first of this. Easy also. To link it to the Ayurvedic system of medicine, the pulse is one and alone measure of diagnosis in primary health care, wherein we are able to establish the samprapti, etiopathogenesis of the disease. And the etiopathogenesis of the disease in Ayurveda is based on the balance of Vata, Pitta and Kapha, Tridosh. An imbalance of the Vata, Pitta and Kapha is then ill health. If you take health, you will find the other is problem in health. Illness is the imbalance in health system of the body. The pulse in particularly when examined in the light of Ayurveda is able to determine the status of Vata, Pitta and Kapha in its normal, elevated, dearranged or below level status, and also the status of normalization. If the Vataj, Pittaj, Kaphaj component of the pulse are normal, balanced, the physician recognizes that the person is healthy. In case Vataj component is increased, the person is liable to have some Vataj disease. Now, the pinpointing to the Vatas disease is then again the etiopathogenesis, that how does Vata affect the whole body, what are the Vatas diseases. Again, what is the status of disease? It is emerging into, or it has emerged with the signs and symptoms. It has achieved the full signs and symptoms of a disease, or it has resulted into complications. A physician should be known to all these components. Pulse again tells you then the intensity of that humoral component. Humors are Vata, Pitta and Kapha. So, this is how the pulse examination is important in Ayurveda, so as to understand the status of Vata, Pitta and Kapha at a particular stage. Now, most of those who are belonging to Ayurveda know that Vata, Pitta and Kapha are never static. They depend on universe, the internal universe of the body and the external universe of the universe which is surrounding us. The status of Vata is in children, is at the youth, or the humors Vata, Pitta and Kapha in the age of Balyavastha, at the youth and the old are different. The Kapha is more prominent in old age. Pitta is more prominent in young age. Vata is more prominent in children's age. But at the same time, these humors are different staging in day and the afternoon and in the evening. At this time of your Agni, that at the time of your taking food, at the time of its being pachan, and after some time when it has already got digested. So the focus of total etiopathogenesis and the health is understood in Ayurveda by status of Vata, Pitta and Kapha at a particular stage. So it is day and night it is the age, it is the time of your taking food, and then many things are again subdivided and studied at various sub-levels. Further, we discuss that during medieval period, Vedas practiced mainly Nadi Pariksha for diagnosis as well as for the prognosis. All of you understand what is prognosis. That is the outcome of the disease. You have diagnosed a disease, you have given your treatment. During this, you have taken note of the status of disease at a particular time. Today also you are making a pro forma, that's after 7 days what happened, then 15 days what happened, 21 days what happened. If your course of treatment is for 1 month, you say up to 1 month I have taken, and later science asks you, have you taken follow-up? Yes, we did follow-up for 2 years. So our science says that if you are really doing the scientific study of Nadi Pariksha and the status of this your Tejosaj component, Vatas, Pittas and Kaphas signals of the Nadi, you will do that at all components and compare it as you are doing for a particular say biochemical in blood. Or at the same time, prognosis is also very important in a disease. Where will the disease end? Either it will end with your good treatment to the health status, or it will deteriorate. So they were doing not for the diagnosis, but also for diagnosis, studying the progress of their treatment, and also declaring or thinking of the prognosis. Today you see in diabetes, you say what you do? Yeah, take a fasting blood sugar. Okay, you do some postprandial blood sugar. And now they say no. They are changing daily. You go in for HbA1c. Get a status of for 3 months. So that is their objective parameter. At one stage, a group of people or a group of societies or group of Vaidyas will like to have another set of diagnosis, and that diagnosis is expected to be Nadi Pariksha. Further, I will discuss what is the relevance of this Nadi Pariksha at the present stage in the scientific era. So, in medieval period itself, the Vedas, those who are authors, they further compiled few more books like Vasavarajan and Karnataka Samhita. These two ancient texts are available even today. Many books has been written now on Nadi. Can I have some water? Here. Many books has come. Many cults and associations and organizations of Vaidyas, they are practicing Nadi Pariksha. There comes many proceedings of various seminars and various conferences, various workshops conducted in past on Nadi Pariksha. I remember in Himachal Pradesh, somewhere in 92, 93, 94, we conducted 2 workshops at Shimla. And we have proceedings and details of patients seen, diagnosis reached, and experiences of various ancient Vedyas and also the contemporary doctors during those workshops. I am happy the Central Institute of Tibetan Studies have chosen this subject and wish to re-establish it as one of the important component of diagnosis. Further up we will be discussing and studying that what could be the advancements in this. Suppose we have we had some system of diagnosis in the past. We had some system of diagnosis at the stage of our economic era. Suppose we were undeveloped country, we had little money, little scope, little instrumentation, no computerization. The era was different. We needed our diagnostic techniques at that time were different. Today we are, if we can't call it a developed countries, but they are leading to be at the upper side of the developing countries. We have economically also come up throughout the world, and we have now access to very, very advanced technology, not only in the medicine, but in the other fields you can see, including the digitalization and computerization. In the era of this computerization, in the era of availability of ultrasound, availability of ECG, availability of electrocardiographs, and what not in cardiac diagnosis, including angiography, what should be the status and where should be the proper utilization of Nadi, that we have to discuss and continue. We have to study it in details and maintain our ancient culture, ancient art of Nadi. We cannot forego this in the light of computerization, and we cannot forget and ignore computerization and advancement also. So we have to make a balance among these two. On screen you have seen the various phenomena of pulse, by what names it is being called worldwide, but the very important, as you daily listen, is it's Nadi, in English we call it pulse, and an important thing is Jeev Shakti. It is a sign of life. Whenever you go to a patient or somebody who is serious and you are to ascertain if the person is living or not, first of all you put the hand on the Nadi. It indicates your being live or indicate yourself being otherwise. But that is the preliminary thing. A person who does not have the movement of Nadi does not mean a person is not alive in today's scenario of electronic area. Today, if somebody's heart is not beating, we have alternative heart, and years together a person still lives on the artificial heart and lung. So, keeping in view such things, we have to keep our Nadi alive, this art alive. We cannot forget it that we have such big instruments, so what is the need of put your fingers on the radial artery? So, let us go to from physiology to the pathology. Ayurveda considers that the root cause of all diseases is imbalance of the dosha, which I just talked to you, Vat, Pitta and Kapha. And cause for all tridosha imbalance is improper food and activities, what we today call is lifestyle. So today's lifestyle terminology is very correct. Our lifestyle will alter our status of Vat, Pitta and Kapha, the balance and imbalance of our tridosh or the humors in the body, and imbalance of tridosh is illness. This is the very precise pathology the Ayurveda has given and correlated to Nadi. And Nadi is an instrument is for us that from Nadi we can just study if our doshis, Vat, Pitta and Kapha under our trained fingers is in balance or imbalance. If it is imbalance, then we study the detail of imbalance. What is balance? How much it is balanced, how much imbalanced, how much percentage, and how much is its on qualities. And then it is the experience of physicians, a Vaidya, that he has seen hundreds and hundreds of patients with a particular feel of his fingers from particular diseased patient Nadi. That is how among hundreds of persons, if somebody utters your name and you just listen, even on telephone a particular person you are able to recognize. But the sound is thing. If somebody will say Jai Hind, Namaskar, hello, even this hello worldwide is spoken by crores and crores of persons on telephone at a single moment. But you are able to recognize a particular sound of hello from a particular person, particular boy, particular girl, particular son. If somebody has 4 sons, a person will be able to recognize the hello of first, second, third and fourth son. So this is what is difference of the sound which a person has listened many times and then he is able to recognize. This is how, when you put your hand on the pulse of a patient with fever, this is how, when you put your fingers on the pulse of a patient of cirrhosis of liver, any disease, if a person has seen 100, 150, and then later on the person has become healthy, he has also seen his healthy pulse. Next time he comes, the physician will put his trained, experienced fingers on his radial pulse. He will be able to recognize the particular disease or particular status of health. So, but the doctor should examine the pulse. In present scenario, when we are discussing this, remembering our past, it is the initial consultation, if we want to define it today. So, in the initial consultation, when we have asked for Ashtavid Pariksha, Nadi is one of the component of in the initial consultation. Always you should study the pulse of a patient. And with the initial consultation, not only initially, after ascertaining the dosha status at the initial consultation, you should continue studying the pulse of that disease up to the end of treatment and a person become healthy, or if there is a relapse, or if there is a prognosis. this should be the normal routine. I discussed about the then pathology, that in all pathological stages the nadi should be examined, and you will learn by time, learn by again and again examining the pulse in a particular case. You will learn what is the touch, how you can do that. So there is a photographic representation of Vat, Pitta and Kapha, 3 points of nadi. If you put your fingers, the base of thumb, near the base of thumb, it is the color signifying the place of Vat, middle part is Pitta, and proximal is Kapha. So these are the 3 spots where you can feel Vat, Pitta and Kapha. Now you have to differentiate all the times by concentrating on your finger and the sense of touch. I gave you an example of hello for the sense of hearing. Now you are specializing here the sense of touch. Now sense of touch is not a crude sense. Sense of touch, if you think in yourself, is very important. In academics, I give you an academic example. Braille is there. You know what is Braille? It is the language for the blind. Anybody knows? You can raise the hand if anybody knows, has seen a Braille book. Good, at least there is one. So, in the Braille book, you put your fingers on the word. So, you move the finger fast, you are able to read the same thing what I am speaking in English. The same thing what you are reading in the newspaper. The same Braille newspapers are also available. Magazines in the Braille are available. Technical magazines are available. So, what they have developed the sense, they have a highly developed sense of touch. With a crude, if there is some plastic one made up, you will do like this. So this is 1. Or if it is 2, 3, you will see, oh, this is 3. But they could do for the very small with their finger touch. That is 1, 2, 3, and not this. If it is a sympathetical word is written, it is a long word, and in the same time he will touch and say sympathetical. So you are developing the sense of putting your trained fingers on the pulse. Will be able to read with your highly specialized sensitive sense of touch from the pulse. Now I talk to you what examples in the past, in the ancient era, also in medieval era, was given by the Vedas to explain the type of pulses. So what pulse feels like a snake or movement of snake or leech. The image is also of the snake. The Pitta pulse feels like movement of crow or a frog, cock or frog, crow or frog. Kapha pulse feels like a movement of Hans or kapot. So you have seen Hans in water, very slowly moving. Or frog you have seen jumping. You must have seen snake running. Now you compare these 3 movements. Now what you do is put all these 3 at separate place and then cover it with your suppose a white bed sheet. Make an experiment. You take that it's a constant, none is moving. Now make them move. And you see them under the bed sheet. There will be some movement you are seeing under the bed sheet. So you can differentiate. There is a frog under this. If the frog is jumping like this. If there is a hunch, you can see the big movement like slowly trying to move in that direction. Or snake you will see. Again appreciate without looking at that. And you make an experiment on the smaller level. You are examining the flow of the blood in your artery under the cover of the arterial wall pressed against the radius. That is the examination and touch feeling of the pulse. So when you put your fingers, not the raw fingers, trained finger, which has learned about the various movements, you will realize. If you ask, कैसे बताएं जी कि ये सांप की तरह चल रही है, कैसे बताएं कि फ्रॉग की तरह इसकी मूवमेंट्स हैं, तो पहले आपको पता होना चाहिए कि सांप की मूवमेंट कैसी होती है. हाउ डज दिस स्नेक मूव्स. Then you are able to appreciate the pulse, that this pulse is Vataj, Pittaj, Kaphaj. Now further go into the details. More higher consciousness is required because you are examining all these three at the same time. You are appreciating the three touches. Usually every human being, brain is accustomed to do one work. Take note of one sense. A person cannot listen to 7 persons at a time. If there are many persons crying, nearby person will be appreciated. Only one. There are few more trained persons who could do 2 works at a time. Conscious and subconscious work. A trained driver, he is talking to you, also driving. He is doing 2 works. And all those works are coordinated by his senses. His eyes are looking at the road. His tongue is talking to and producing sound. Sound is being produced. If he is eating something, the taste of his tongue is alternatively sensed. It's alternatively sensed, not equally. Hence, our touch of the pulse is also alternately sensed. So we must be so fast, so trained to see first, second, third, what first finger is telling, what second middle finger is telling, what index finger is telling. Further we can understand as what is a low volume but high rate pulse. Pittaj pulse is high volume and high rate pulse. Kaphaj pulse is high volume and low rate pulse. And Sannipataj means Tritoshi pulse is variable in volume and variable in rate. Now where do we see these pulses? Mostly we see the pulse as the radial pulse. We also see the brachial pulse. We also see the carotid pulse. We also see the femoral pulse and distal pulses. We also see the abdominal aorta pulse. But this is for further diagnosing the further particular diseases. So we have to, when we go further become a pulse physician or a pulse specialist, we have a wide range of pulse examination and diagnosis. Now, we talk of the radial pulse. Radial pulse, all of you know. So, it is at the side of the wrist. It assesses the rate and rhythm Simultaneously, sometimes we study the radial as well as femoral pulse to detect the delay at the stage of this femoral. Brachial pulse, we assess the character of the pulse and also confirm the rhythm. Carotid pulse, it is best for the pulse character and to some extent left ventricular functions. It also makes us to detect the carotid stenosis. Femoral pulse. So like that, it is again the list of this presentation is in your computers, and all of you are welcome to make copy of it and keep it to you. Further, you can have discussions and email me. I will be happy to interact with you. So, different type of pulses at different places. As the topic was that pulse diagnosis in cardiovascular and hepatic disorders. Cardiovascular is almost clear to you that pulse is the music of the heart. Pulse is created by the systole, one after the other. The radial artery is the nearest to the heart and better appreciated. Most of the heart diseases are reflected in pulse, but not only this, most of the diseases of the total entire body, including psychosomatic disorders, the things are reflected in the pulse. And we should learn one by one to practice that. As time is short, I have been given a reminder of that. Now I come to the liver. As I said, that not only the heart, but any organ in the body, including the mind, body, and even your soul. If you are happy, your pulse is different. If you are sad, your pulse is different. And the component of sadness also defines the different pulse, and you can diagnose what has caused the sadness and what type of treatment, is a counseling or a medicine, is required for the patient. So mostly the rate, volume, rhythm, all are affected by liver disorders also. Liver, is important in making blood. So blood volume as well as the flow of the blood, both are affected by liver diseases. That we can study from the pulse. So I studied and discussed with you the mental illness like anxiety, valvular heart disease, anemia, and fever. For example, the pulse reflects its own music, which you should listen to, learn, and appreciate through your fingers, which you must have to be trained. Interpretation of the pulse, one thing I may discuss, is an individual art. It cannot be immediately reproduced. That you say, Professor, you are able to recognize this disease through your pulse examination with your fingers. Let me also put my fingers on his artery and appreciate it. No, it is not possible unless you learn it, repeat it, and reconfirm it yourself, and then you can examine and finalize it. Now there are further many conditions I have listed. For example, that in CHF Kapha Nadi will be there. Left ventricular failure, Vata Nadi will be there. Aortic regurgitation, Kapha Nadi will be there. Cardiomyopathy, Dosha Nadi will be there. Proximal ventricular tachycardia, Vata Nadi will be there. Hypertension, Kapha and Pitta Nadi will be there. There are many lot of lists we have made, for example. And now, if we give an example of the liver disorders, hepatitis will have Hepatic Nadi. Obstructive jaundice will have Kapha Nadi. Cirrhosis will have Vata Nadi. Cirrhosis will have also a bonding pulse. Liver abscess will have Hepatic Nadi, and so on. There is another component, do and dots. Who should not be examined for Nadi Pariksha for reliable diagnosis? Now, sometimes you say that tomorrow you come fasting and I will examine your pulse. Tomorrow you come fasting, we will take your blood for this examination. So there are certain things that if the person has just taken bath, he has just taken food, he has just undergone this snehan, a person is very thirsty, he is very hungry, he has not slept. So such person should not be examined for pulse, for diagnosis at that particular moment. I give a simple example that you go to a physician that I want my blood pressure dekh lijiye. Kindly examine my blood pressure. He will say, okay, sit down for 10 minutes. You have come from 4 kilometers and you are having lot of breathlessness. The doctor knows that his blood pressure is already more raised. Let it come down and then I will examine. So is that pulse should not be examined in all these conditions. This is mentioned in Ayurvedic Shastras. Another thing is important in pulse, that you should also learn prognosis. There are many slides and I hope he is preparing for another reminder for me. So I should now thank you. Pen drive.
Dr. Tamdingla, to offer the shows to the expert.
You want to copy? Yeah. Copy and distribute to them. I am already honored by being over here.
Okay, that's very good. This is sure.
Yeah, come here. He wants to take a photograph.